you joined us for the first segment. That it was fantastic, a fantastic conversation with Dr. Phillip Yu. Before we get back into it, I want to ask, are you suffering with knee pain? Have you tried the shots, the pills, yet you're still suffering with chronic knee pain caused by bone-on-bone arthritis or a torn meniscus, or maybe you had a fall or accident? Have you been told that you need knee replacement? This is the important part, because here's the good news from Dr. Phillip Yu, founder of 21st Century Knee Pain Institute. You may now have hope of reducing or eliminating your pain with a new non-surgical, painless laser stem cell treatment, the West Coast's only laser-guided stem cell therapy. This new treatment may reduce or eliminate your knee pain in minutes. Here's a special offer, so pay close attention. If you have chronic knee pain, Dr. Yu is offering a special $97 new knees in a day exam that includes an infrared laser joint inflammation scan, a Neuro 7 nerve test, X-ray, MRI review, and a knee surgery prevention plan. Normally $375, but today just $97 for the first 27 callers. To get this offer, grab your cell phone and dial pound 250 and say knee pain. There's only a limited number of $97 exams. So on your cell phone, dial pound 250 and say knee pain. This is a great, great value for anybody who's listening and wants to just jump right in and go see Dr. Yu at the office. So Dr. Yu, where we left off, you were talking about when somebody comes in, the scan that you're giving them you want to make sure you're taking a holistic approach. You're looking at the entire body and identifying where the problem's actually happening, because it's not always localized to the knee.
Exactly. So I talked about, we do a nerve test and we check to see if the nerves that control the knee joint and muscles are working correctly or not. And if they're not working, then we can do some therapies on the spine to get those nerves firing correctly. And then we check the whole knee structure, the whole body structure. You know, again, if you have bow leg or knock knees, we have certain wedges you wear that help, unload the forces on the knee. All right. A lot of doctors will prescribe what's called an unloader brace, to unload the knees, but it's very bulky and it gets hot, and after a couple weeks they throw it out. But we have just wedges that help align the knees, and you just put them in your shoes, okay? And then we'll look at other factors like, so another cause of knee pain that a lot of people don't understand is a lot of times they're told, like I said, it's because it's bone on bone that's causing the pain, but it may not. A lot of people are told it's the weather, or you're overweight, when a lot of times it is the nerve that controls the knee that's not working properly. And if we can fix that, a lot of times we can avoid those surgeries. Yeah.
Mm-hmm. So tell me about the actual therapy then. What's happening? What is the stem cell therapy? How does it work? How does it help?
So before we determine if a patient is a candidate, after we take a look at their structure of their whole body, the nerves, we will do what's called infrared scan thermography test. And we have a special infrared laser we use that detects the temperature of the knee. And if the temperature is very high, we know what area of the knee has the most inflammation. Typically, if you have a bow leg, you're going to have more inflammation on the inside of the knee. That's where the pain is. And the temperature will be high. If it's the outside of the knee, it'll be opposite. Like a knock knee, you're going to have more temperature wear and tear on the outside of the knee. And that will give us a laser accurate point of where we're going to put the umbilical cord stem cell to regenerate the meniscus, the cartilage, the function of the knee. Because stem cells are activated by inflammation. It's called cytokine signaling. So we want to put the stem cells where the point of the knee that's hottest, if you will, has the most inflammation. So we don't want to waste those cells going to a part of the knee or body that doesn't have the inflammation.
So they're naturally activated.
Well, not naturally. There has to be some type of a signal in your body.
Okay.
All right. There's the type of stem cell we use is called a mesenchymal stem cell, MSC in the industry, MSC. But I like to call them, instead of mesenchymal stem cell, medicinal signaling cell, because they actually signal your body to repair itself. That's how they really work. They're like a first responder, like a fireman.
Yeah.
He's not going to go to a house that's not burning, right? A stem cell's not going to go to the knee if it doesn't have inflammation. So if I do my inflammation scan and you don't have inflammation, I'm not going to recommend the stem cell. It's not going to work. But if you have a high degree of inflammation, then we'll recommend the stem cell, because you could think of a knee, if it's hot, it has inflammation, arthritis, bone on bone. There's a lot of friction causing heat. That's what's causing the swelling and pain.
Yeah.
So there's a signal in your body, and the stem cells will go to the knee and help regenerate it, get rid of the pain and inflammation. And then another stem cell, which is the Bob the Builder stem cell, will come repair the meniscus, you know.
That's wild. So you're using two different kinds of stem cells.
Exactly, yeah.
That's so crazy.
So one part of the stem cell fights the inflammation.
Uh-huh.
It also has an immunomodulatory effect, so it fights, you know, infections, boosts your immune system. And then another part of the cell is not actually cells, are called growth factors, you know, like hyaluronic acid, fibronectin, collagen, and that gives like a scaffolding or the basic building blocks, you know, to repair the knee.
Right.
Yeah.
You know what? I want to go to the phones, but before I do that, let me just ask, if you're suffering with knee pain, if you've been listening to this and it's resonating with you and it's making sense, you may now have hope of reducing or eliminating your pain with a new non-surgical, painless medical breakthrough, the West Coast's only laser-guided stem cell therapy. You're listening to us talk about it right now, but if you want more information, this new laser treatment may reduce or eliminate your pain in minutes. If you have chronic knee pain, attend a special knee pain lunch and learn seminar and learn how this new laser stem cell treatment can guide your old knees, can give your old knees new life and start you living pain-free. Grab your cell phone, be one of the next 27 callers, and the knee pain lunch seminar is free. So dial pound 250 and say knee pain, and you'll be connected on your cell phone. Just dial pound 250 and say knee pain, and you get the education that we're only on the air for an hour. So we can give you bullet points as to what's going on, how this procedure works, but you're gonna have more questions for your specific situation where you can go there and you can ask these questions. This is a free education for you. So please take advantage of it. Hit pound 250 and say knee pain. We're gonna go to the phones.